Hello and good evening. I'm Melisa Idris.
And I'm Sharaad Kuttan.
You're watching Consider This, the show where we want you to consider, and then we consider what you know of the news of the day. As we're about to begin phase 2 of the National COVID-19 Immunization Program on April 19th, we're seeing, reflected in the recent statements by the Coordinating Minister Kari Jamaluddin, a certain willingness on the part of the government to recalibrate its strategy in managing the COVID-19 pandemic in the face of emerging challenges. So over the next 30 minutes on the show, we're going to be examining some of the areas that have come into sharp focus recently that may need recalibrating. These areas that need to be addressed include low levels of registration by senior citizens and those with disabilities, the role of general practitioners in the National Vaccination Plan, and identifying other areas that need to be recalibrated. So we have Professor Dr. Shahrul Bahyah Kamrul Zaman. She's a consultant geriatrician at University Malaya Medical and Specialist Centre. She joins us on the line now. Dr. Shahrul Bahyah. Now, less than 2 weeks before the phase two of the National Immunization Program starts, we have data that shows that of those aged above 60, and those with comorbidities and those people with disabilities, that only 3.1 million have signed up for COVID-19 vaccination so far. And I'm wondering, why this is, because this is really far below the government's target of inoculating 9.4 million people as part of phase 2. Why do you think this is, Prof. Shahrul, that the numbers for sign-ups are so low?
Thank you. For inviting me, and this is a very timely interview, really. So the answer is really, it's obviously not, and not just in the elderly, it's a wait and see approach. And many people are looking to wait and see what happens, and behind it lies several reasons for their hesitancy. Number one is namely safety of the vaccine. That needs to inspire confidence amongst those who are particularly frail and those with multiple medical issues. Number two is the uncertainty on the side effects of the different types of vaccines. Now, that's been quite under great debate. And number three is the lack of understanding of what truly happens when an older person gets COVID-19. And having been on the COVID task force on the first and second wave, I've seen how it affects older people differently than younger people. And that an older person who is especially vulnerable, when they get COVID-19, there are various concerns in that they don't present the same way as a younger person does. They may have non-specific symptoms like losing their appetite, feeling tired, a bit drowsy, but not the raging fever, the cough and shortness of breath. That only comes later, by which time they will need respiratory support and therefore go into multiple complications which may affect multiple organs and sadly sometimes mortality. So, and the second part about not understanding how serious COVID-19 could be for older people is that the isolation that needs to take place, and for frail and dependent older people who are admitted with COVID-19, being in an isolation ward can have repercussions on their ability to eat and care for themselves. And if they're dependent, this puts them at greater risk of having further longer stays in hospital and even complications of their pre-existing illness. So there's a balance to be had between being concerned about the side effects of the vaccine with the actual seriousness of having the infection itself and getting vaccinated for it.
Dr. Shahrul, I want to ask you though, in terms of the government's own rollout of the vaccine, it seemed a very neat division of demographics. You work with, in the phase 2, the most vulnerable. But if the vulnerable are hesitant and for all those complicated reasons that you mentioned earlier, is it wise then to just give them a much longer runway and bring forward, as the government has decided to do, the demographics in phase 3? Do you think that makes sense, that we should now just lengthen the runway for older folks?
Well, yes and no. Yes, in that it needs greater planning. And one of the ways in which we could actually plan for it more efficiently is to activate our country's public health more efficiently. And in our country, we have we're very, very lucky in that we have public health departments in every state that comes under the purview of Ministry of Health. So by utilizing their expertise and knowledge, we'll be better able to reach those who are really vulnerable, to access registration, manage the barriers to registration on MySejahtera, to allay any fears on safety, and how we can strategically better communicate the importance of vaccination for those who are vulnerable.
Well, thank you for bringing that up, because we will be speaking to private healthcare, the Association of Private Healthcare, after this on the show. But you mentioned registration through MySejahtera, and I'm wondering whether that's been a barrier for older people to sign up for the COVID-19 vaccine. The low take-up, is that due to a lack of knowledge about digital registration channels, about internet constraints, and I guess perhaps a lack of understanding how to use these apps like MySejahtera?
Well, MySejahtera can be both a barrier or a way in which to get through. So the answer is yes and no. Yes, in that a majority of our older generation in our community may have smartphones, but may not have the full knowledge or ability to download apps as easily as a younger person would, or register anything online. So that could be the barrier. And no, in that, well, the government has provided a way for children of older parents to register them on their behalf. But the question really is this sufficient?
And
Shahrul, this would depend.
I want to ask you that. Sorry, we're running out of time. But very quickly, if the approach is for older people to register, would it be better to reverse that and for government and to go to them rather than expect them to come to government?
Yeah, so yes. So for those who are very vulnerable in nursing homes, yes, go to them. Engage public health within the community in each state. Get multi-level strategies going on with NGOs who care for older people, geriatricians, primary care who are trained in looking after older people, even dementia care centers, caregivers who are experienced in managing older people. Get the strategy out there within the public health realm to actually prepare older people. Be flexible with timing of the vaccination. Have a longer observation time in these community centers, vaccination centers. Engage the GPs so that should there be any adverse events occurring during which can be expected, we are prepared to deal with these complications if they do occur.
Well,
so there's an opportunity to address all this.
All right, thank you so much for speaking with us tonight, Dr. Shahrul. Appreciate your time and your insights, and thank you for bringing up the role of GPs. That's exactly what we're going to be talking about. After this break, we'll speak to the Association of Private Medical Practitioners. More after this. Stay tuned.
Mampukah rangkaian anda memperkasa organisasi anda
induknya adalah Melayu
balik kepada Islam. Orang yang membuat polisi.
Kalau itu yang dikehendaki, fine. Mungkin kita berbeza pandangan.
Tapi kita mempunyai kuasa yang boleh menentukan budaya di masa hadapan.
Polisi yang mesra wanita, sudah tentu dia akan datang daripada pemimpin wanita.
Perang COVID-19 masih belum berakhir. Dalam kita berusaha memutuskan rantaian wabak ini, kita jangan terpedaya dengan virus maklumat palsu. Simak fakta melalui www.astroawani.com atau aplikasi Astro Awani. Teruskan berdisiplin, ratakan lengkungan pandemik ini.
The third wave of COVID-19 has taken us by storm. There's no room to take anything lightly. Everyone must follow all the steps to stop the spread of COVID-19. Social distancing, face mask, follow these steps, this SOP with the utmost discipline. Together, we can flatten the curve.
Bila sentuh soal berita, tiada masa untuk tunggu. Kepada anda kami bawakan fakta, susulan dan kupasan yang terkini. Tiada drama dan tiada pengulangan. Usah tunggu lama-lama. AWANI 745 lebih awal dari biasa.
Kini berwajah baru.
Ini pula susulan khas pesawat Back Air di Kazakhstan. Pesawat berkenaan dilaporkan tergelincir 2 kali.
Notifikasi berita terkini dan navigasi mudah. Podcast dikemas kini dengan berita dan program.
Rebirth, Reformasi, Resistance and Hope.
Serta video tanpa had dengan scroll tanpa henti. Buat turun aplikasi baru Astro AWANI sekarang.
Semua yang terjadi adalah berita, tetapi tiada siapa yang boleh bawakan yang terkini dan tergempar seperti kami.
Dilihat hanya memberi wang tanpa matlamat yang tepat. Dia tidak melakukan apa-apa kesalahan.
Untuk mendapatkan jawapan yang bermakna, kita perlu soal.
Hello, you're watching Consider This. I'm Melisa Idris. With me is Sharaad Kuttan. If you've just joined us, we're discussing a recalibration of public health measures as the second phase of the national COVID-19 immunization program is set to begin in less than 2 weeks. Now, the Ministry of Health has announced that general practitioners, or GPs, will be engaged to administer COVID-19 vaccines for the second and third phases. Now, we're going to be speaking to Dr. Stephen Chow now. He's the president of the Federation of Private Medical Practitioners Association, Malaysia. Dr. Chow, thank you so much for joining us on the line today. Now, we understand that as of the end of March, less than 2,000 GPs have registered as, if I may call them, vaccinators in the national COVID-19 immunization program. That's about 27% of the some 7,000 GPs nationwide. Can you help us understand, Dr. Chow, why is it that it's at this figure, 30%? So few GPs have signed up to be part of the vaccination plan. I mean, what's behind the seeming hesitancy on the part of GPs?
See, Melissa, there is clearly not much we call motivation or motivational factors in the process of signing up. For a GP to sign up, we have already polled this amount of members in the KL slang. There are so many A, B's and C's that have to be done, which makes it almost impractical. To start with, all right, the GP will have to compile the names of the patients and have this sent to the system. They have to go and collect the vaccines from the system. They have to system a situation in a clinic where there's a door going in and a door going out. Now, what is all this for, in fact, clearly? Tell me, are GPs not giving vaccines all their lives? What's the difference between giving a COVID vaccine and giving a flu vaccine or perhaps a polio vaccine? What is all these unnecessary bits and pieces for? And it is actually a structural issue, you know?
Right, Dr. Chow, could you help us understand? You seem to have clearly laid out some what you think are bureaucratic barriers to the entry and participation of doctors. It's not that they don't want to do it, it's that there's no incentive or there are in fact some disincentives to being part of this program. Has that been forwarded to the government? Have they been told about these, what you think are unnecessary measures?
If they are bothered to ask, they would have been told. Okay? All right, now the GPs themselves are raising, hey, guys, we ourselves have not been vaccinated, and you expect us to be giving the vaccines? Where's the logic in this?
Dr. Okay? Chow, GPs have not been vaccinated?
Oh, lots of them are not vaccinated. Just talk about chaos slang. We are looking at the list ourselves. Okay? All right? There are many GPs that have not themselves got their first dose.
Right. Well, that's clearly one thing the government has to address. But what else would you like to see from the government in, I guess, trying to involve general practitioners as part of the national COVID-19 immunization program?
I think this partnership got to be meaningful, okay? And it's got to be practical, all right? You cannot expect a GP to vaccinate, say, 90 persons a day and expect them to be observed for half an hour. Can you? And how does it work in an average day of the general practitioner? What about all these other patients, all right? And you have terms like they must be wearing full PPE when giving vaccines. Why? You have to explain to me why. Why must a GP be wearing a full PPE when giving a vaccine? Yeah? There must be a reason for it, which we ourselves are not aware of. The patient must enter one door and exit through another door. How many doors have a general practitioner's clinic got? When a person gets the flu vaccine, does he enter one door and come out through another door? When you get a polio vaccine, do you come up, go in from one door and come out from another door? Now, all these are ridiculous requirements. Okay? It's got to be practical. All right? And
Dr. Chow, I understand you're concerned about the lack of practicality in the design of this GP dimension of the immunization program. You said that government hasn't reached out to the Federation. Do you intend, as President of the Federation of Private Medical Practitioners Association of Malaysia, do you intend to put these thoughts forward to the government?
Oh yes, we regularly put it. Okay, if not in the form of letters, we have put it in the press. All right. So this has been done. I think it's important that whoever is designing this called private-public partnership should come to the ground, talk to the general practitioners who will be involved. All right. And clearly, even the very system that is thought about, for us, the first practical system would be for the patients to come in the clinic, okay, have them duly registered while in the clinic, have the jabs given, have the information entered through whatever system that is practical, be it MySejahtera or otherwise. Okay. So-called pre-planned number of patients at what time, what date is possible. And the same will go for the kind of vaccines that require super cold chain.
Right.
Yeah.
Okay. Dr. Chow, thank you so much for speaking with us on the show tonight. We appreciate your time. We're going to take a quick break on Consider This, but stay tuned. We'll be back with more.
Mampukah rangkaian anda memperkasa
saya maju hentikan induknya adalah Melayu.
Balik kepada orang yang membuat polisi.
Kalau itu yang dikehendaki, fine. Mungkin kita berbeza pandangan.
Tapi kita mempunyai kuasa yang boleh menentukan budaya di masa hadapan.
Polisi yang mesra wanita sudah tentu dia akan datang daripada pemimpin wanita.
Perang COVID-19 masih belum berakhir. Dalam kita berusaha memutuskan rantaian wabak ini, kita jangan terpedaya dengan virus maklumat palsu. Simak fakta melalui www.astroawani.com atau aplikasi Astro Awani. Teruskan berdisiplin, ratakan lengkungan pandemik ini.
The third wave of COVID-19 has taken us by storm. There's no room to take anything lightly. Everyone must follow all the steps to stop the spread of COVID-19. Social distancing, face mask, follow these steps, this SOP with the utmost discipline. Together, we can flatten the curve.
Bila sentuh soal berita, tiada masa untuk tunggu. Kepada anda kami bawakan fakta, susulan dan kupasan yang terkini. Tiada drama dan tiada pengulangan. Usah tunggu lama-lama. AWANI 745 lebih awal dari biasa.
Kini berwajah baru.
Ini pula susulan khas pesawat Back Air di Kazakhstan. Pesawat berkenaan dilaporkan tergelincir 2 kali.
Notifikasi berita terkini dan navigasi.
Thank you so much for staying with Sharaad and I on Consider This. Let's continue our conversation about how our COVID-19 pandemic public health measures must evolve as challenges emerge. Independent health policy specialist Dr. Khor Kheng joins us on the line now. Hello, Kheng. Welcome back to the show. Now, since the national immunization program was announced and the first dose was given, what's new on the vaccine horizon that's, I guess, reshaping the management of the pandemic? I mean, what ought policymakers be cognizant of?
Melissa, maybe we'll have a look at Malaysia first and then the rest of the world. So the biggest news in Malaysia is that we've got the Sinovac vaccine that was started in our program beginning the 18th of March. And then we've also got the third vaccine approved, the AstraZeneca vaccine. It's also been marked by a series of some rather slow uptake of people registering on the MySejahtera application to receive the vaccine. So up till today, we've got about 7.5 million Malaysians registering. So that's a little low and a little slow for this part of the campaign. And we probably need to pick it up as we go along. That's on the Malaysia side, that's happening, that's new. On the global side, maybe there are two new requirements or rather two new updates that we need to be mindful of. The first one is the presence of new variants, and there are three variants: the UK variant, the Brazil variant, and the South Africa variant that are variously impacting the rollout of the vaccination programs. And hopefully we'll be able to discuss some parts of that tonight. And the second thing that's coming up is something that should be part and parcel of the vaccination programs around the world. We've seen that the adverse events reported in Norway in January, for example, when several old senior citizens have passed away, and more recently for the AstraZeneca vaccine in terms of blood clots. So in terms of the adverse event reporting and how we handle these adverse events, will be something for us to be mindful of going forward. So Melissa, those are some good places to start as we look at the updates in the landscape since Malaysia started our vaccination program about 6 weeks ago.
Okay, Swee, thanks for that summary of all the different things we can talk about in the next couple of minutes. I want to pick up one of the early points you made about the slow take-up. Now, the slow take-up on many fronts, right? One we have with older folk, and it's led to a decision to, as it were, extend the runway on people in that demographic and bringing up people from the third phase, as it were, into the timeline. What do you make of that decision in terms of recalibrating the timeline of the rollout?
Well, for a start, we must be mindful that this is a very dynamic landscape. And because it's a very dynamic landscape, we should be building in some flexibility within the way we make decisions. And in some ways, we can support the decision to bring forward phase 3 into phase 2 and let them have these vaccinations as early as possible in the hopes that we'll reach the herd immunity as quickly as we can as well. So I would say that there is some flexibility that should be built into the system. However, there's also the other way for us to look at it. And if we're, in a sense, giving up, well, we're not really giving up, but let's assume that we are thinking that we're not trying as hard as we can to get as many people as possible in phase 1 and phase 2 vaccinated, then we might also not be able to, say, achieve the objectives that we want, which is not just herd immunity, that's a long-term objective, but the short-term objective will also still need to be to protect those who are most vulnerable. Right. So my overall point being, while we can be a little flexible because the landscape will always be dynamic, there are some things that have to remain constant. And some of these things that will always have to remain constant would be how quickly can we vaccinate those who are truly in need of our protection. So perhaps here the government can reconsider new ways for us to more aggressively encourage those who are supposed to be vaccinated in phase 1 and phase 2 and truly get them in phase 1 and phase 2 instead of making it earlier for those who are in phase 3. Right.
Yeah, we've been talking about precisely that on the show, you know, how to encourage more sign-ups of the elderly and those with comorbidities and those with disabilities. But you mentioned something quite interesting a bit earlier, Swee, which is the emergence of these variants, right? The variants of the virus. How would that affect our vaccine strategy now as we're going into phase 2 and we're looking at phase 3 now? Has that all been built into the design of our immunization program?
That's a difficult question to answer, Melissa, because some parts of it are built into the vaccination program, the National COVID Immunization Program, or NCIP, but it deserves greater elaboration. So the Minister Khairy Jamaluddin and his team would do well, I guess, to share more of this information about our variant strategy. And I understand that there'll be some announcements forthcoming in the next few days as he describes and elaborates more on the variant strategy for Malaysia. But here are some considerations for us to think about. Firstly, it's not for us to take any rash actions, which is what I mean to say is just because we hear one report of one variant causing one vaccine not to work in one country, we should not immediately react and take that vaccine off the table. I think these things require some time for the data to settle and for more information to come out in a way that can make sense for us. So what I mean to say is we have a bit more time, and therefore we shouldn't be rushing to making any decisions as it relates to variants. And this is a good first strategy. The second strategy is for Malaysia to determine whether or not we do have those variants in Malaysia. And this means that our genomic surveillance, this is a term that means that we need a new set of laboratories to rather dramatically increase the number of tests that we can do to determine if we do have the UK variant or the Brazil variant or the South Africa variant in Malaysia. This is different from the routine antibody testing or antigen testing to determine whether or not you do have COVID. Right now, we want to know what sort of COVID that you have. And this is the second strategy for Malaysia to ramp up the ability for us to surveil the genomes that are available. Thirdly, there's a scientific strategy, meaning Malaysia needs to partake in the way we procure these medicines to make sure that there's a clause whenever we sign a contract that enables us to get a new vaccine from AstraZeneca, Pfizer, Sinovac, Moderna, and any other company.
Do we have that clause in our contracts? Do you know if we do?
Well, my guess is we don't. But my guess also, and I'm happy to be corrected over here, Melissa, my guess is that no country in this world has thought that far ahead because we've just procured vaccines as quickly as we can without building that clause in. And if I can make a final note about the science of it, we also need a new way to customize the vaccines as quickly as possible, also to get them approved by NPRA, perhaps using an accelerated approval pathway for seasonal variations or variations of the vaccine. These are the strategies that should guide the variant or vaccine variant strategy for Malaysia and also other countries.
Swee, and you've been on the show before talking about how the principles that we enunciate have to take into consideration global supply shortages. There's a limitations on global supply. How, on that landscape, how do you think that global supply will impact our national program?
It will impact in two ways, Sharaad. The first one is without variants, and the second way is with variants that are having a clinically significant outcome. So let me talk about a non-variant approach first. So let's assume that we don't have any variants that render any of these vaccines ineffective. Right now, the world has got 600 million shots that have been given, and there are contracts for up to, I believe the number is 10 or 15 billion shots before the end of 2021. We simply do not have the manufacturing capacity in order to produce that many shots for the whole world. Therefore, one example that we can think about is companies like Merck, Sharp and Dohme, or MSD, have been contracted to build or produce a J&J vaccine, and I think this is fantastic. And if J&J, AstraZeneca, and so on will be able to outsource or contract out the production and manufacturing of their vaccines, I think this would really help the vaccine supplies around the world. The second consideration is for us to regionalize or localize our manufacturing. So Siam Biosciences could export to Southeast Asia, or Malaysia's companies could produce locally for local consumption, and as well as export to the other parts of Southeast Asia as well.
Swee, you've given us so much to think about. Thank you so much for joining us on the show tonight. We appreciate your time. That's all we have for you on this episode of Consider This. But before we leave you tonight, another quick reminder, don't forget to get all the latest news and information on COVID-19 vaccines. You can get it at astroawani.com as well as the Astro Awani app. Thank you so much for watching the show. I'm Melisa Idris.
And I'm Sharaad Kuttan, signing off for the evening.
We will be back with you same time tomorrow. Till then, good night.